The COVID-19 pandemic has changed our way of life for generations to come. Simple actions such as hugging a stranger or greeting everyone with a handshake will, in my opinion, cease to exist for a long period of time after the pandemic has subsided. With this being said, however, I saw more of the firsthand impacts of the COVID pandemic than most people at this university. I live 14 miles outside of New York City in Ramsey, New Jersey, which is a very small middle-class suburb town filled with many people who commute to and from Manhattan for work each day. Not only did I spend a majority of quarantine being just miles from the George Washington Bridge, but also New Jersey is the most densely populated state in America. This lifestyle of millions of people all in very close proximity to one another is the perfect breeding ground for the epicenter of COVID. The state government, in my opinion, did a great job at flattening the curve and sending it into a downward trend. As soon as the news broke that COVID had finally taken footing in the United States, essentially everything closed in New Jersey. This included restaurants for everything but contactless takeout, hair and nail salons, clothing stores, and most other businesses. Eventually, masks were mandated in every business and store, and they're still mandated even today. It stayed like this for months. June 22nd was the first day in New Jersey that nail and hair salons could open up with very large restrictions, and outdoor seating is finally open. However, the government waited until it was safe and until our New Jersey and New York hospitals could handle a possible second wave of patients as a result of opening back up in the state. On the other hand, however, the federal response was not so comprehensive. It was really frustrating to see some of my friends who lived in other states fully acting as if COVID was not real because things were open again. I'm not gonna lie, I would probably be doing the same thing if we had the ability to go into certain businesses and restaurants that were open again. The government essentially was rather careless and reckless, in my opinion, for prioritizing things such as businesses over the lives of their citizens. I believe that Governor Murphy, the governor of New Jersey, did the best thing that he could for the citizens of New Jersey by staying firm in his plans and opening the economy slowly and in phases. New Jersey is still under very large restrictions, and it is possible that a second wave will come back. However, the federal response did not take the same guidelines as New Jersey one did. Certain states did not follow CDC guidelines for the proper amount of time before opening and putting their businesses as the first priority. This is possible because for the most part, the federal government left the states up to their own governments to respond to COVID-19, and he left it up to the states. However, the federal government did do a great job in allocating what resources we had to the proper places that needed them the most, such as the New Jersey and New York and Connecticut hospitals, because there were an astronomically higher amount of cases in New Jersey and New York and these densely populated states. New Jersey and New York were essentially the epicenter of the COVID-19 pandemic. My town had well over 200 cases, despite the fact that we are only 4.5 square miles large. New Jersey had over 171,000 confirmed COVID cases, with over 13,000 deaths. This was a hugely devastating statistic for our state, and it has caused major lifestyle and business changes that will be in place for the foreseeable future. I agree for the most part with the response of the New Jersey government and the Phil Murphy administration. However, not with many of the other states' efforts. As I said before, it was really frustrating to see all of the other states start to open up and ease up on the CDC guidelines very prematurely, and it's honestly backfired for a lot of states. States such as Florida and Texas, Arizona, and South Carolina are now seeing massive spikes in cases, which will just further put the rest of the country at risk. I agree with the federal government making it a state issue because not all states are set up the same, and certain states have much more space and are much less populated and are much less densely populated, which was honestly the big issue in New Jersey and New York. And therefore, not all states should have been treated the same because it is definitely a state-by-state basis, and they don't all require the same attention or restrictions. However, I do think that there should have been certain federal measures that were taken and put in place that were in accordance with the CDC guidelines to ensure that all states flattened the curve around the same time and that all states were taking the same measures and adopting the same guidelines to keep everybody safe. Because although we are part of different states, we travel between states. So spikes in certain states will just lead to spikes in other states. It's not like the COVID pandemic stays within one state. As people start to travel and things start to move between states, so will the new spikes. And so therefore, I think that as a federal government, we should put certain things in place in order to protect everyone in the states, but then on a more restrictive level, that should be based upon the state governments. Lastly, I think that the local policies that are in place right now in New Jersey and New York will most likely stay in effect, in my community at least, for a long time. Being from such a densely populated suburb, I feel as though it will stay very restricted like this, with the outdoor seating and the restrictions on the hair and nail salons and all of the non-essential businesses, and even certain businesses will stay closed until we have a certain more concrete treatment for COVID-19. However, I think that New Jersey is doing the best that they can do at this time with the resources that they have and with the effects that we already have seen from COVID-19, and it will continue to slowly reopen. However, I don't think it will be completely open until we see a more concrete treatment or vaccination or something like that for COVID-19.